Assalamu alaikum.
Assalamu Walaikum Salam.
Do we have the permission to record you and, if possible, post them on our websites as well?
Yes, you can.
Okay, thank you very much. So, could you please
Mhm.
introduce yourself?
I'm Dr. Unaiza Sharif, a fourth year resident in general medicine and currently working in Holy Family Hospital, Rawalpindi. Holy Family Hospital is one of the centers dedicated for the management and prevention of the COVID in the current pandemic. So we are directly concerned with the management of the patient as well as the vaccination of the patient in this regard.
Okay, so I'll give you a briefing of our topic and the issue. So, our main topic is disease and health, and the sub issue in this is the fraudulent production of COVID-19 vaccine certificates. So, in your
Mhm.
opinion, do you think this issue is prevalent in Pakistan, or is it at a very minor or major scale?
About the fake vaccination certificate you are asking.
Yes.
Okay. This is an issue. This is a very serious issue that is going to happen in Pakistan. I don't know exactly how many persons or exactly what is the mass of that fake certificates, but in my opinion, um the population that is going to get vaccinated is large as compared to the population that are getting the vaccination fake certificates. Um, I may not be the right person to tell you about the exact number of the fake certification because the patients that are coming in the hospitals are actually the patients who are already giving us the consent to get vaccinated. Although, in my opinion, the one of the biggest reason for that fake certification may be the poor policy, that introduction of the COVID vaccination card as an entry pass to the various locations as examination centers, at the polling stations, at various get-togethers and the gatherings like the wedding and the things. And for the vaccination of the COVID, we actually require we have to have a 28-day window to get fully vaccinated and to get the original vaccination card. So the persons who may having the plan to have an event in the coming few days, like 2 weeks, like 2 weeks or more, maybe they may require to have a fake certificate to get entry into that particular event or the exam or anything they are planning. So might be this may be the one of the biggest reason for the population that they are getting the fake certificate.
Okay. So basically, we wanted to interview a doctor who is directly related to the COVID-19 vaccine, and we found that you were a highly, capable candidate in that regard. So the reason we wanted to
Mhm.
interview you was that we wanted to know if there were people who were facing hesitation while getting vaccinated, because a major reason for fake certificates, as is also the hesitancy of people, and the other
Mhm.
that you have already mentioned, which is as a pass to certain restricted places.
Mhm.
So,
Uh, um, as I said before, that about the hesitancy of the people, we are actually I'm not directly concerned with the people who are hesitant to get vaccinated, because whoever is coming to the hospital is having a clear purpose to get vaccinated. So I
okay.
may not be a right person for the population that is not coming into the hospital.
We did a survey in which we found out that the majority of people did not face hesitation to get vaccinated, but yes, there was a minimal around 30% people who did face vaccination. So, leaving your
Mhm.
experience beside, what is your perspective? What do you believe? That do you think that people are actually hesitant to get vaccinated or not?
Yes. There is a population, I think, who are hesitant to get vaccinated. These are actually the persons who have the other comorbid condition. although it is highly suggestive that the patient having comorbidities should get vaccinated first. But a person who is sick because of some other illness, they might have a perspective that if they get vaccinated, they may deteriorate. The vaccination is not tested on so many people, and they are not believing that their body is ready to accept. Because I think the people having diabetes, hypertension, and the other issues believe that their body is weak to accept the vaccination. That might be one reason that they are hesitant to get vaccinated.
So you mentioned that people are hesitating to get vaccinated due to prior illnesses because they believe
Mm.
that the vaccination might actually cause harm to them instead of good. So this reason, this belief is basically, stemmed from the, you can say, stemmed from the belief that the vaccination might cause further harm than cause good. So a
Yes.
course of action, a solution might actually be spreading awareness that the vaccine, yes, the vaccine is safe, and yes, it is, safe for the permitted age groups and will cause better and not harm.
Yes, of course. This is the same scenario as we are facing in the case of the EPI vaccination that are being done in Pakistan from last 70-75 years. But the the population is still reluctant, and then they don't believe. They have different beliefs that this will affect the fertility and this issue. This is the same case in case of the COVID vaccination. This is the same thinking behind this, that the people don't believe the vaccination to the full extent. I think there is another reason that is again a misconception among the people. The person who got the COVID recently believe that they may not need the vaccination for about 4 or 5 months or the 6 months. There is also one reason that they might be delaying the vaccination or not getting vaccinated. This might be one reason why the people are not getting vaccinated.
So basically, in conclusion, that there is a misrepresentation of the vaccine. So a
Yes.
suitable solution would be spreading awareness regarding the vaccine that it is safe for injection into the human
Mhm.
body.
Mhm.
So
Yes.
now comes the part where we really needed the opinion of a certified doctor, which was in asking that is the vaccine really safe?
Yes. It is safe. Um, we have observed a few side effects with the vaccination. Uh, I can name a few complications which may not be appear in literature yet, and we are planning to have a deep research on on these events. These are actually the small cases that we observed during our vaccination process of our population. One of our patients have the blurred vision after he got vaccinated, but he improved after a couple of weeks. So this side effect was reversible. Another patient has the problem with the joints. He got the swollen joints after a period of 2 weeks after he got the vaccinated. We gave him steroid. Sorry, and he also improved with that. The other complications that occurred after the vaccinations are the same as occur after any kind of vaccination, like the mild fevers, little bit rhinorrhea, and the things like that, which are quite common. So we observed a few side effects that may be related to that vaccination, but there is no such side effect observed yet by which we say that you don't get vaccinated. So there is no harmful and a long lasting side effect observed with the vaccination during that period.
So basically, very severe or unexpected side effects occur in very extremely rare cases.
Yes, if have we have done the vaccinations of thousands of the population, thousands of the people in the population. I can name only one or two side effects that are observed, and these are again reversible, and we don't consider the reverse.
Thank you so much. And as for the final question, we'd like to ask that what do you think about the injection of the vaccine into people of smaller age groups or people of larger age groups, for example, teens or elderly people?
The younger population, we recently started to vaccinate the young population. But the reason is not this that it is dangerous to administer in the youngsters, but the reason is that we actually have the limited resources, and we want to vaccinate first the people who are at higher risk of complications of the COVID.
So,
I think you are getting my point. That the reason of not vaccinating the younger population initially was that we are preferring to vaccinate the population who have less capacity to fight the COVID.
okay.
As a
Uh,
younger population has a better capacity, so we delayed the process of vaccination in younger population because of the limited resources, not due to the side effects of the vaccination in that population.
so, which age group would be most vulnerable to the COVID-19 virus?
Elderly with diabetes and with respiratory problems.
Those were all the questions, and we successfully were able to gather all the information that we needed. So, we would like to
Mhm.
thank you so much for that.
Thank you.
Thank you so much.